guys, welcome back to my channel, or welcome if you're new here. My name is April, and today I have another nutrition video for you. So this is just one of many in a Nutrition for Nurses series, and today's topic is going to be diabetes mellitus. Now, obviously, when we talk about diabetes, nutrition plays a really large role. Now, there are some very specific nutrition goals when we think about diabetes. Now, remember, diabetes is a chronic condition, and it is one in which glucose metabolism is impaired. Now, if you don't understand the way glucose is metabolized in the body normally, check out my channel. I do have a video on that. I will also link it in the description box below, as well as I have a video on the pathophysiology of diabetes mellitus, if that's something that you still don't understand. And I will also link that down below in the description box. However, let's go back to nutrition goals. So our first goal and our most important overarching goal is going to be to achieve and maintain euglycemia, which is normal blood sugar. So for an adult under the age of 60, that's going to be between 74 and 106 milligrams per deciliter. So we want to achieve and maintain euglycemia, or as close to that as possible. And here's the key word: consistently. We also want to achieve and maintain a blood lipid profile that reduces the risk for cardiovascular disease. So we do know that uncontrolled diabetes mellitus, or those sugars that are just all over the place and not consistently controlled, is a contributor to cardiovascular disease. So we will see macrovascular and microvascular changes. Macrovascular changes that we will see is related to the heart. We also want to prevent and slow the development of chronic complications from diabetes. So again, those macro and microvascular changes. So the macro being problems with the cardiac system, problems with the brain leading to stroke. Microvascular, we can see peripheral neuropathy, we can see diabetic nephropathy, we can see retinopathy. So all of these problems that are caused by uncontrolled blood sugar. We also want to address client nutrition needs, and this is important. We want to take into account any personal or cultural preferences so that we can help this client stay motivated to make nutrition changes. We also want to maintain the pleasure in eating by limiting food choices only when absolutely necessary. We want to meet nutrition needs across the lifespan. So remember, when we think about diabetes type 1, we could be talking about a very young child, a 7 or an 8 or a 9-year-old. And when we think about diabetes mellitus type 2, we could be talking about, a young adult, a middle adult, an older adult. So we really do want to be able to meet nutrition needs across the lifespan. We also want to take into account a client who is diagnosed with diabetes, who is pregnant or lactating. And then last, we want to provide self-management education so these clients are able to take care of themselves. So that's eating well, that's understanding how exercise impacts diabetes and glucose, and also being able to check blood glucose levels and then treating with insulin, if that's indicated. Okay, let's talk about our energy nutrients. So this is going to be carbohydrates, fats, and protein. Carbohydrates for the diabetic client, we want them to consume primarily complex carbohydrates. We really want to limit simple carbohydrates. So when we think about what the difference is, remember, simple carbohydrates are those mono or disaccharide carbohydrates that are very easily digested by the body. And in your mind, you think, oh, that's great, they're very easily digested. But the problem with that is they cause spikes in the blood sugar. So we eat them, they digest and hit our bloodstream in about 15 minutes, and they very quickly raise our blood sugar. But then, of course, think about if when you eat a Snickers bar, you also then that blood sugar drops all from that sugar high all the way down to that sugar low. And that is not going to help us achieve consistent blood glucose. But complex carbohydrates, those are polysaccharides, they take much longer to digest. Eaten on a regular basis going to help us manage our blood sugar consistently. So when we eat these complex carbohydrates or polysaccharides, they digest very slowly. When they hit our bloodstream, if we need them immediately to raise the blood sugar, they will do that. Otherwise, they will be stored. So of course, the next time that we need sugar because our blood sugar is low, those complex carbohydrates which have been stored in our liver can then be pulled back out. So what we want to teach clients is that somewhere between 45 to 65% of total caloric intake should come from carbohydrates. And again, the majority of that is going to be complex carbohydrate. Our best sources of complex carbohydrates are going to be raw vegetables and fruits, so with the skin on them, or minimally cooked vegetables and fruits, so minimally processed. Whole grains, so oats, barley, whole wheat, legumes, and dairy products. And then we also want to make sure that we are getting at least 25 milligrams of fiber daily. So remember, one type of complex carbohydrates is fiber, and we do want our diabetic clients to be eating at least 25 milligrams daily. So when we think about fats, much like when we're thinking about cardiovascular health, we do want to limit saturated fat. So we want to be less than 10% daily caloric intake of saturated fat, but if we can get closer to that 7% or even lower, that's what's best for our cardiovascular health. We want to absolutely limit and, if possible, avoid trans fat. Our monounsaturated fats also lower our cardiac risk factors. So think about your Mediterranean diet. Very good sources in that Mediterranean diet of monounsaturated fats. We want to restrict cholesterol to less than 200 to 300 milligrams per day. Again, 200 or less is ideal for cardiovascular health. And then we do want a diet that at least includes or even is rich in omega-3 fatty acids. Best sources for those are going to come from fish and fish oil supplements. There are certainly other sources, but fish is really going to be the best source. The recommendation is fish is eaten 2 to 3 times per week. For protein, we want complete proteins, and those should comprise 15 to 20% of caloric intake. Now, if your client is already experiencing some of that diabetic nephropathy, so the kidneys have been affected, then we might need to reduce that protein intake if you have any degree of kidney disorder or failure. However, without kidney involvement, then around 15 to 20% of caloric intake should come from proteins. So the majority of this diet is coming from carbohydrates, in particular complex carbohydrates. As far as exercise, we do want to encourage exercise and weight loss. So we want any client who has diabetes mellitus to have a BMI less than 25. So we want to be in that healthy weight category. Remember, healthy weight is between 18.5 and 24.9. So of course, exercise is very good for our diabetic clients, but it does consume energy. Well, guess what? Glucose is energy. So when we eat those carbohydrates, they come into our body as blood sugar. That sugar, once we have insulin in our body, pushes that glucose into the cells where it is converted to energy. Well, when we exercise, we consume energy. So if your client is diagnosed with diabetes mellitus, especially type 1, if they have planned exercise, so maybe they know, later on today they're going to go for a run or a walk or a bike ride, they're going to want to reduce their insulin dosage because they won't need as much insulin because they're going to be using more blood glucose while exercising. So more blood glucose is going to get converted to energy. And if they continue with their regular insulin dosage, then they might push themselves into hypoglycemia. If they're going to have unplanned exercise, so all of a sudden they just decide it's a beautiful day and I want to go for a walk or a hike, or they're going to do high intensity exercise, they're going to want to consume additional carbohydrates. Now, if they know they're going to do that high intensity exercise, they can also reduce insulin dosage, but they are going to need to consume additional carbohydrates, and that's going to be about 30 minutes before. So remember, exercise uses blood glucose. So if we continue on with a normal insulin dosage, we run the risk of hypoglycemia after or in the middle of exercise, depending on how long you're going to exercise for. The recommendation for exercise is 150 minutes per week over about 3 days. Now, certainly you can exercise more than that, but that is the recommendation. Now, diabetic clients should not exercise if their blood glucose is less than 80. They don't have enough blood glucose right now to exercise, or if their blood glucose is greater than 250. We want to be in that normal glycemic range before we do any exercise. Now, after exercise, we want to closely monitor glucose for about 24 hours because remember, we have consumed energy. And on top of that, maybe we've eaten enough, maybe we haven't. We've also probably taken our insulin if we were a type 1 diabetic. So we really want to monitor glucose closely to make sure that we don't need to eat more food because we're hypoglycemic or take more insulin because we're hyperglycemic. Now, typically with exercise, a type 1 diabetic will need less insulin and additional carbohydrates. Okay, other recommendations: no smoking. Smoking does increase our risk for cardiovascular disease, as does diabetes. So we don't want to put the two together. Smoking also increases the risk for hyperglycemia. We want to limit alcohol consumption. So when we say limit, what we mean is 1 beverage per day for women is the maximum, and 2 beverages per day for men is the maximum. Now, a beverage is defined as 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of like a hard liquor or a distilled spirit. Artificial sweeteners are acceptable for use. Clients to use that have diabetes, there is no sugar in those artificial sweeteners, so they are acceptable for diabetic. However, we do want to avoid those sugar sweetened beverages. So like your regular Cokes, your regular Sprite, iced tea that's sweetened with sugar. We want to avoid anything that is a beverage that is sweetened with sugar. However, artificial sweeteners, those are fine. We do want to monitor blood sugar very closely. People who have diabetes are typically monitored blood glucose 4 to 6 times a day. So always before meals, and then usually 2 hours postprandial. So that's after meals. Postprandial means after meals. Sometimes they'll even do 1 hour and 2 hours after meals. It just depends on how brittle of a diabetic they are or how well controlled they are. So usually AC, which is before meals, 1 or 2 hours after a meal, possibly, and then at bedtime. And then we do want to limit sodium to 2,300 milligrams per day. Again, this is about cardiovascular health. Remember that if we can get that sodium level even down to 1,500 milligrams per day, that's even better for our cardiac health. But 2,300 milligrams per day would be the max. Okay, let's talk about carb counting. So carb counting is really effective for a lot of clients, particularly type 1 diabetics, as long as their intake is pretty consistent. So what happens with carb counting is the client will count the total grams of carbohydrates in each food item that they're going to eat. It doesn't matter what the source of the food is. Regardless of the source, they're just going to count the total grams of carbs that are going to be in the food item, and then every food item that has carbs in the meal. Now, we can do that, or clients can accomplish that by reading nutrition labels. So really important that our clients, and especially our diabetic clients, know how to read a nutrition label. Then they're going to calculate their mealtime insulin based on the number of carbs they're planning to consume. So if they're going to consume 15 grams of carbohydrate, that is going to equal 1 unit of rapid acting insulin. And so again, clients who are carb counting are using rapid acting insulin. So they're going to calculate the total number of grams that they're planning to eat of carbohydrate, and then they'll equate that to the correct number of units of rapid acting insulin. Remember, rapid acting has an onset between 10 and 20 minutes. So they're going to take that rapid acting insulin immediately before they eat their meal. So that's carb counting. Then they're going to monitor their blood glucose, of course, before they eat, and then 2 hours, that 2 hour postprandial blood glucose, so 2 hours after meals. And this is going to help them determine the effectiveness of their calculations and their insulin regimen. Now, it's important to remember that if your client is on a fixed insulin regimen, consistency in timing of meals and carb consumption is really critical to prevent hypoglycemia. So what we want to teach diabetic clients is that they need to eat regularly at around the same times every day, and that we want that to be 3 meals and then snacks in between. So 2 to 3 snacks. So a snack, in between breakfast and lunch, in between lunch and dinner, and then a bedtime snack, so that our blood sugar stays elevated, in that normal range, not hypoglycemic overnight while we're sleeping. So consistency is really important. Okay, let's check your understanding. So the last couple of videos, I've been putting in some practice test questions, and a lot of people have enjoyed that. So let's go ahead and do that for this content. So here's our first question. Now, again, remember, you can always pause the video if you need more time to read through the question and the answer options. So a nurse is planning to create dietary guidelines for a client who has type 2 diabetes mellitus. Which information should the nurse incorporate into the dietary plan? And this is a select all that apply. So the answers to this question are going to be weight management, lipid profile, cultural needs, and personal preferences. And we talked about that with our nutrition goals, right? We want clients to have a healthy BMI. We want to maintain a normal lipid profile that's helping with helping to reduce cardiovascular risk. We do want to take into account cultural and personal preferences in our diet planning. Sleep patterns is not related. Okay, next question. A nurse is presenting information to a group of clients about nutrition habits that prevent type 2 diabetes mellitus. Which should the nurse include in the teaching? And this is also a select all that apply. Okay, so answers to this question: A, eat at regular intervals; B, decrease intake of saturated fats; C, increase daily fiber intake; and E, include omega-3 fatty acids in the diet. So we talked about consistency of meals and how important that is for our diabetic clients. We do want to decrease that intake of saturated fats. Less than 7% is ideal, 7% of daily caloric intake. We do want to increase daily fiber intake, and then we do want to include omega-3 fatty acids in the diet. So limiting saturated fats to 15% of caloric intake would be incorrect, because we want that to be less than 7%, 10%, but 7% is ideal. A nurse is reinforcing dietary teaching to a client who has type 2 diabetes mellitus. Which instruction should the nurse include in the teaching? And this is once again a select all that apply. Okay, answers to this question. Carbohydrates should comprise 55% of daily caloric intake. And eat something if you choose to drink alcohol. Hydrogenated oils, those are going to be saturated fats. We do not want hydrogenated oils. We do not want trans fatty acid consumption, and we do not want to be adding table sugar to anything. Okay, next question. A nurse is reviewing a client health record that includes a report of weight gain in the abdomen and lab findings of elevated blood glucose and triglycerides. The nurse should identify that these findings are manifestations of which condition? Okay, so maybe you knew this, maybe you didn't. If you don't know anything about metabolic syndrome, I did talk about it in my nutrition video for cardiovascular health, so that might be something that you want to check out. Metabolic syndrome is a chronic condition in which the client has 3 of 5 problems, one of which being elevated blood glucose, but another being triglycerides, another being an increased LDL cholesterol, another being obesity, especially around the abdomen. If you want to check out more about metabolic syndrome, I did talk about that again in my nutrition for cardiovascular health video, and I will link that in the description box below, as well as in the card in the sky. So that is going to be the answer to this question. Anemia would be a decrease in red blood cells. Of course, this client does not have any symptoms or findings that make us think heart failure, nor does it say anything specifically about hypertension, although hypertension is one of the factors of metabolic syndrome. Okay, last question. A nurse is teaching a group of clients who have diabetes mellitus about meal planning. Which client statement indicates understanding? Okay, best answer to this question is going to be, I will not eat canned fruit in syrup. So wrong answers, I will avoid having snacks. No, we said 3 meals a day and 2 to 3 snacks every day in order to maintain a normal blood glucose level. I should not eat anything containing sugar. Well, that's not true. All carbohydrates have sugar in them. That's why they're called carbohydrates. We do want the majority to be complex carbohydrates, but we do know that eating a diet very rich in carbohydrates is necessary for someone who has diabetes. Remember that carbohydrates are our body's best source of energy. So again, this kind of goes back to understanding the way the body metabolizes glucose normally, understanding that that is our best source of energy. It's the source that our brain needs for survival, and how when we don't have glucose for energy, our body breaks down fat, which is a whole nother huge problem. So again, I will link that video on normal glucose regulation as well as diabetes pathophysiology in the description box below if you feel like those are things that you need to brush up on. And then our last incorrect answer, I will not eat more than 2,800 milligrams of sodium per day. So we can have up to 2,300 milligrams of sodium per day, but really what we want is closer to 1,500. So those are incorrect answers. Okay, guys, that's all I have for you today on nutrition and diabetes mellitus. Hopefully you found that helpful. However, if you need any other help with diabetes, I do have several videos on my channel specifically related to diabetes and glucose regulation, as well as numerous products in my Etsy shop, including a product on insulin. So all the different types of insulin, their peaks, their durations, their onsets, easy ways to help you remember them, how to mix insulins together. If you have any questions, don't hesitate to reach out. You can send me an email, you can find me on Twitter and Instagram, or you can definitely leave a question down in the box below and I will be happy to respond here as well. Have a wonderful day and I will see you in the next video.